the World Health Organization has exceeded, it says, its polio vaccination target for children in central Gaza. Over 160,000 children under the age of 10 have been vaccinated on Sunday and Monday. The initial target was 156,000 for both days. So there was a slight increase there in those numbers. Let's unpack it further with Hisham Mhanna, who is the International Committee of the Red Cross spokesperson in Gaza. Hisham, thanks so much for talking to us today. And, you know, I think perhaps a good place to start, just to try and understand the vaccination program for children in Gaza and the extent of the vaccination program. Of course, it all started with Gaza's first confirmed case of polio in 25 years that left a 10-month-old baby partially paralyzed just last month. I mean, what are the conditions that would lead to the first case of polio anywhere in the world in a quarter of a century?
Thank you, Michelle, for having me. Honestly, the situation in Gaza, the dire humanitarian situation, the absence of hygiene items, the spread of infectious diseases, the poor living conditions of the displaced communities across all of Gaza Strip in the north, in the middle, and the south, the spread of the sewage water. People are living amidst modes of untreated water, and also they are living on the streets in rudimentary tents without proper nutrition, without proper access to food and clean water. And that's the perfect formula for the spread of vicious infectious diseases like cholera, hepatitis A, scabies, other respiratory diseases, including also the vicious polio. Gaza was declared free for over 25, 30 years from polio, and no child should bear the brunt of war comparing to what's happening to the children of Gaza. This is what caused mainly to the detection of polio in Gaza.
Yeah, you've already talked about the issue around access to clean water, but it's also around just the general disruption, and disruption is probably putting it mildly, but the disruption to vaccination programs for children in general over the past months.
Of course, many people who are reliant on the provision of healthcare service on a regular basis have been deprived from that. That includes people with chronic diseases, cancer patients, pregnant women, and that also includes vulnerable children who are sick, or babies and infants who are entitled for vaccinations against polio and other diseases as normal as any other normal child in the world. The continuation of the armed conflict, the active hostilities across Gaza, not only disrupts that process, but also prevented the spread of this infection and this reality now that we are dealing with from happening, which is why the International Committee of the Red Cross has warned against these threats, these issues for months ago. And we have been in direct dialogue with parties to the conflict, including the Israeli authorities, about the importance of giving the access to civilians for whatever that's needed necessary for their survival. And that's the responsibility of Israel as an occupying power in Gaza.
Yeah, we talked about the first case, this 10-month-old baby who was left partially paralyzed last month. But perhaps, Hisham, a good opportunity to tell us more about polio, which has been eradicated in most parts of the world. You'll give us the correct data?
I'll give you a very, very basic, simple example. We have a local partner, the Artificial Limbs and Polio Center in Gaza, which provides services for persons with disabilities, mutations, and we are reactivating our joint cooperation to continue the provision of services for this vulnerable group. And they were considering before the war to adjust their title and remove the polio from their name. That was the success that was achieved over the many years, over decades, and was just destroyed over the brunt of these 10 months. Which is why the International Committee of the Red Cross is joining efforts with health actors who are implementing the vaccination process, primarily with the Ministry of Health in Gaza, the World Health Organization, and UNICEF. And we are facilitating the vaccination process at our field hospital in Rafah, which is one of very few hospitals that are still operational across the area of Rafah at the outpatient department. And if there's any further medical care is needed, required, that case would be transferred to be treated or to receive the urgent healthcare service they need inside that hospital.
So Hisham, polio vaccinations, we've exceeded, as the WHO, the target that we had of just over 156,500. It's now well above 161,000. Do you reckon, as the International Committee of the Red Cross, that that number may well still rise? It doesn't seem like there's a firm grip on exactly how many children are in need of this vaccine.
Well, first of all, the target was to achieve 90% of vaccination for all children under 18 across Gaza Strip. We're not sure how is that going to be implemented efficiently in northern Gaza, given that the issue of access or safe access on a regular basis as much as needed to the north. However, the health authorities declared that the mission is accomplished in the middle area after vaccinating over 180,000 children. And now, starting as of today and tomorrow and until next week, the process will be undergoing in the south, including Rafah. The ICRC field hospital will be one of these vaccination centers. The reason why we have been warning from this issue at the very early times of this conflict is that the armed hostilities disrupt the process of screening that is required to declare an epidemic or not. The case was different during COVID, and we were actively engaged with many actors in order to start dealing with this global issue, including here in Gaza Strip. Now it's more sophisticated, it's more complicated. There are more constraints regarding to very limited humanitarian aid entering Gaza Strip, the security and logistical constraints imposed by this conflict and by the armed hostilities everywhere, and also the fact that the healthcare teams have been exhausted over 10 months of responding nonstop to hundreds of thousands of cases generated by this horrible.
Yeah. So this was the first round of this vaccination campaign, according to the WHO. There's a second round, and repeat immunizations are set to start in the coming weeks as well. What do you think, in a context where vaccinations for babies and children have been disrupted to this degree, where do we start now to try and get them back on track? What are the diseases that would be at the top of your list as the International Committee of the Red Cross on where we begin here?
Well, this is a very important question. All waterborne diseases, all infectious diseases that are causing respiratory issues are a major concern. We have also other concerns about people who are injured and require medical care outside of Gaza Strip because it's not available, and they need to exit Gaza and receive the medical treatment before they lose their life. There are many issues. There are many humanitarian needs that are unattended, and the situation in general is beyond all the humanitarian sector's capacity to respond to, as long as this conflict is not put to an end anytime soon. The humanitarian space is shrinking and all levels, impacting everyone, impacting everything, every aspect of life, including the potential for the continuation of the required vaccination process against polio and against any other diseases. I have been myself infected with hepatitis last month, and it was a very horrific experience. I cannot think of the people who are living in displacement, who are living out there in tents, who do not have access to clean water, who do not have access to the healthcare they deserve, and they have to run every night almost for their life whenever there is a new evacuation order, whenever there is an airstrike nearby. That's the reality the population entirely in Gaza is dealing with. There's no safety at all.
And of course, now almost 11 months into this conflict, women and children still the worst affected.